Okay. So I think today it's very overwhelming of the informations, and I think that the last lectures would be more relaxed and just to keep you some or introductions about travel medicines. I would like to ask who's of you here have encountered pre-travel consultations to the travelers before going, or even you yourself finding some informations, preparing some health before that you travel. Okay, at the front row. Oh, okay, okay. Some of the participants asked me she's going to Africa recently. So, okay, so today I will talk about travel medicine, which is the new emerging specialty in Thailand. And we have the travel clinic in Bangkok to provide the comprehensive pre-travel consultation and also see the post-travel evaluations in e-return traveler as well. Very more relaxed. Okay, this is Grand Palace in Bangkok. If you come to Bangkok, you don't miss to go there. So just to introduce a little bit on travel medicines and the when is counseling necessary. For example, I mean, like you traveling to a neighboring country, you may not need to see the doctor before coming, before traveling, or even to Bangkok. It's very safe, right? So who is encounter pre-travel consultations? All right, I already asked already. Yeah. So I usually show this slide because we are in a small world. As I told you that we can travel to another part of the world within 24 hours, as well as the pathogen as well. So for example, like COVID-19, it can cause the pandemic within 3 months. And yes, of course, not just the mosquito can travel. Human travel along with the some pathogens, right? With the, I mean, for example, with many countries reported the outbreak or concerns of the emerging infectious diseases. And as you may heard about I'm not sure the news about almost 10 years ago about the first imported yellow fever virus to Asia by the workers, I mean, Chinese workers working in Angola. And fortunately, there's no further outbreak or orthoconus outbreak in the area. But this is the first time that we imported yellow fever in Asia. And why we do concerned? Because in Asia, especially in Southeast Asia, we have mosquito, yellow fever. I mean, it's viral hemorrhagic fever transmitted by mosquito. And it's ED can carry the virus. So East Asia, we have EDs, we have populations where we never immune for yellow fever virus. So we have vulnerable populations which is not immune. And once someone bring the virus into the countries, they have the possibilities to cause the outbreak. So that's why yellow fever is one of the very serious diseases that the Ministry of Public Health Thailand very consider, especially if you're returning from yellow fever endemic area. So just to show you that, okay, in travel medicine at the moment, the knowledge is quite dynamic. Sometimes most of the travelers, for us, they use many AI generated like ChatGPT. They use ChatGPT, they use Google before coming to see us. So that's why we have to know more than the ChatGPT, right? For example, yeah, if I'm going to Nigeria, which vaccine you recommend? They recommend a lot, but in especially they recommend in general considerations. But as I told you that, please do not uh, lose the ChatGPT because you are the physicians. So at least they said that, okay, if you are the uh, specific purpose, or if you give them a very more detail on that, they will say that, okay, you should consult with the travel medicine specialist. But I mean, I have seen a lot of travelers, I mean, encounter with pre-travel consultations in the rooms. And once we talk something, they ask ChatGPT along with us. This is a thing that occurs during the pre-travel consultations. So the point is that at the risk of travel is not just infectious disease. Of course, infectious disease, this one is one of the risks while travel. And they have the potential of the spreading of the infectious disease from one country to another, right? And also with the traveler health themselves, they may have some underlying medical conditions, and the risk of exacerbations while they travel is also one of the things that we have to concern, especially if the uncontrolled diseases, for example, epilepsies or asthma. And some other travel-related problems is not infections, it's not infectious disease, like acute motion sickness, decompression sickness while you dive into the sea and you develop the decompression sickness, and risk of accident, especially in Thailand. So people got almost 10 of vaccine before they traveled to Thailand, and sometimes they die because of traffic injury, traffic accident, because their first time trying motorcycle in Thailand, which is very dangerous. And yeah, of course, some psychological problems like culture shock and whatever. So the practice in travel medicines, so to comprehensive travel medicines, we divided into three main parts. The first is the pre-travel visit, just to give the travelers risk assessment by the health background and also itineraries to see whether they have the risk. What's the risk they will encounter while they travel depends on the risk itineraries. And this is account around 80% in the travel clinic practice. In my clinic, most of the cases, most of the clients coming to my clinic is for pre-travel consultations. And we have seen some post-travel evaluations. You got sick and then you return. And we have to evaluate what the cause of a fever. But in our clinic, because we are located in the travel destinations, we are located in Bangkok, Southeast Asia, where the travelers traveling around, sometimes they got sick while they travel. So that's why we call they got sick while they travel as well. This is we call the during travel visit. For example, like the disease where the incubation period is very short. So they don't need to return and develop symptoms. They can develop symptoms while they travel, like influenza, respiratory, and also with the dengue, for example. And we have to do the surveillance, preventions, and control and research, right? So this is the interesting uh, uh, scale. We try to identify what's the risk, vaccine preventable disease risk among travelers. We call this Stephanogram. Professor Stephens in Zurich, he tried to gather the information, the risks of the vaccine preventable diseases among the travelers. And you can see after COVID-19 is more common, right? Influenza, dengue, for example. But for this is the not high risk, but it's very, very fatal, as I told you, that rabies, for example, rabies in traveler is rare. I would say in the published literatures within 20 years, no more than 100 cases of rabies in travelers. But you can see that rapid animal exposure, it's common. It's around 1% that travelers traveling to tropical and subtropical area and they contact with rabid animal. So this is a thing that we have to consider that, okay, even rabies is rare. It doesn't mean that they cannot contact with rabid animal. And once they contact with animal, they have to have some idea what should they do. For example, they should get pre-exposures or they should try to seek for post-exposure. And in travel medicines and risk assessment in travelers, we don't assess only the incidence of the disease. For example, some diseases, even it's rare diseases, but once they have the very high impact or very high case fatality rates, we have to consider if they have the vaccine, we should consider the vaccine to prevent it as well. So this table is just to mention that we don't focus just only the high incidence of the health problem, because sometimes it's high incidence, but the impact to the travelers or case fatality is not that high. For example, like respiratory tract infections, influenza. But for some disease like Japanese encephalitis, rabies, for example, it's not common. But once you get infected and you have symptoms, it can be fatal, right? And we know in our practice, there's no vaccine package in travel medicine. What does it mean? It means like if you are travel to India, two individuals may have different recommendation. For example, I mean, Mr. A backpackers to India for 1 month, and Mr. B going to business trip, the same country, India, business trip for 3 days. So you can imagine that, okay, these two travelers have different exposure and different risks that they have encountered. So the recommendation is also different as well. And also, for example, like this Peru. Anyone have been to Peru before? Okay. Okay, only one. Okay, in Peru, this is one of the common destinations for the, North American traveler and also with Thai traveler as well. So Peru is here. And you can see that Peru, this is Peru. They have different geographical locations. They have Amazon rainforest, Amazonian rainforest. They have high altitude. They have coastal area, and they have even the lake, for example. So the point is that once you risk assessment in the travelers before giving them the consultations, we have to know the detailed itineraries, whether even in Peru, where exactly in Peru they are going to expose. Like in Amazon rainforest and high altitude, they have a different risk and health problem as well. India, for example, most of you like India, like to travel to India. So India is subcontinent, right? So, and also they have different uh, uh, geography. Like this Taj Mahal, high altitude, New Delhi with crowded of people, Varanasi, for example, like sacred place. So just to example that even in the one country, they have different geography and also with the different exposure as well. So this is the way that we approach when we encounter the pre-travel consultations. We have to do the risk assessment by assessing the medical history of the patients prior of their travel, specific itineraries, not just the country, and also the activities, and also with other factors like budgets, mode of transmission, transportations, or type of accommodations. And we have these standards. So remember that we have one individuals come to see us. We have to see whether what is the exposure they are going to expose. And in-house intervention, for example, what do we have to give them to minimize that risk? For example, if I'm going to exposed with yellow fever virus, we have yellow fever vaccine to give them to minimize the risk. So we call the standard in office interventions. The one of the interventions that we have, and it's very powerful, is the vaccine to prevent the disease. And in the pre-travel consultations, that what we need to know is that we have to know the geographical health risk at the destinations. You have to know what's going on that area, what's going on, what the outbreak, what the situation is at the moment, medical history and travel history of the patients, individual risk assessment, and the standard interventions and preventive measures. And as I told you that we have the vaccine. So when we consider the vaccine for travelers, we have the three categories. First, we call the routine vaccine. It just, I mean, patients coming to ask for a pre-travel consultation. This is the good time for you to ask them to catch up or update it with the adult vaccination as well. So you have to catch up some routine vaccine like tetanus, diphtheria, pertussis that they may missed many years ago, for example. And one other thing is that the routine vaccine in different countries is also different. Like EPI programs in Thailand and the US or European country may different. So some country, for example, Japanese encephalitis vaccine in Thailand, we consider as a routine vaccine because we give to the children since they was a child. So that's why it's may consider as a travel vaccine in other country as well. So required vaccine. Yellow fever, I mean, I would say, I mean, I'm not sure in Hong Kong, but in Thailand, yellow fever is the only one required vaccine for the travelers who going to yellow fever endemic country to get injected before they travel, and they need to have the proof of the vaccinations before they travel, and they will check after you return from the yellow fever endemic country. And meningococcal vaccine in some specific events like Hajj pilgrims or Umrah that they are going to attend the mass gathering events, and they're required to get meningococcal vaccine before they issue the Hajj visa, for example. And the rest is the recommended vaccine depends on the risk exposure of individual patients. So minimize the risk while the travel is the important. So this is the study that they done is that they found the patients will get the vaccine because the physicians or the healthcare provider give them the informations that, okay, you should get it because you have the risk. So once the patients or the clients receive the correct or accurate vaccine, they tend to accept the vaccine while they encounter the pre-travel consultations. And most of most of the clients who didn't get the vaccine, they said that because the doctor or healthcare provider don't tell anything about them. So that's why they don't receive it. So we are one of the key roles that try to promote the vaccine preventable disease or catch up some vaccine or necessary vaccine. Even they don't travel as well. So as I told you, that routine vaccine and travel vaccine in some country might be different, depends on the EPI programs. Just to show you some example, this is the records of the clients, and they asked to catch up this vaccine. Do you know this vaccine? Initially, we don't know as well because we don't have that. This is tick-borne encephalitis vaccine. So tick-borne encephalitis vaccine is endemic in the Europeans mostly, and they have the vaccine available, but it's not licensed to use in Thailand and in many countries in Asia as well. So that's why we don't know about that. So the point is that even we are the doctor in Bangkok or even in Hong Kong, you have to know the vaccine that available in other country as well. For example, I would usually give the example of rabies vaccine. We have rabies vaccine with different brand and different post-exposure prophylaxis regimen or guideline. So even you are a doctor in Hong Kong, you have to know what's the standards treatment or what's the brand of the vaccine that they're available on the that travel destinations to utilize how we uh, deal with the doctor and with the patients. And this is also with the other vaccines, like for Japanese encephalitis. In Thailand, we use live Japanese encephalitis. But in the US and in Europe, they have inactivated Japanese encephalitis, which is different platform of the vaccine. So this is a basic thing that, I mean, if we are working in the travel clinic should know, right? So this is just for example cases that 30 years old Thai male going to the travel clinic before they're going to Gabon. Do you know Gabon? Where is Gabon? So if you are the clinician or physicians and you don't know Gabon, it's it's finished because you cannot imagine where the Gabon look like or what's the travelers going to expose in Gabon, right? So Gabon is in the West Africa, right? Sorry, it's not West Africa, it's Central Africa, right? And the thing that we should do is that we need to do the individual risk assessment by asking the questions like this. This is on the list of the questions that you should ask for them. And also risk communications. We have to, once we get some informations and we have to encounter that what is the specific health risk they are going to encounter, for example. And risk management, what's a vaccine that could minimize the risk for this trip? And also with the prophylactic medications like malaria, for example, adjust some chain of plans if they are going to a very high risk area or some outbreak area, or postpone or cancel the trip. So we have to evaluate the plans and give them the suggestions or recommendations. And yeah, so this case, he said there's no underlying medical conditions and cannot recognize any vaccination history. We're working with 3 colleagues in Gabon for 1 week's business trip, mostly in the hotel, leaving Thailand next month, and request for yellow fever vaccines, right? Just a little bit on yellow fever. I'm not sure. I mean, some of the professor will touch a little bit on yellow fever. This is one of the acute viral hemorrhagic fever transmitted by the mosquitoes, and it's endemic in almost in South America and Africa. And yellow fever vaccine, I mean, we have used for a long time, and it's a live attenuated vaccine. The vaccine itself is very safe. The point is that the vaccines contain a viral virus in the vaccine. So it's a live vaccine. So that's why in some group of people, especially immunocompromised or the ones who have the T cell dysfunctions disease, they might develop the severe adverse event following the yellow fever vaccinations, which is one thing that we concerned. The point is that one single dose provides lifelong protections. Previously, they recommend to booster every 10 years, but now they consider one single dose provide lifelong protections and they need to get it 10 days before the travel. I will not get into detail on the vaccine that much. Just to let you know about something about yellow fever, as you can see the map. So one traveler is going to Tanzania. Tanzania is here. If you look at the map, it seems like the vaccine is not recommended, right? So one of the national parks in Tanzania that they are going to travel is Serengeti National Park. So around here, it's along the border of Kenya and Tanzania. They have the national park called Serengeti National Park, and close to Serengeti, they have the Masai Mara National Park, which is located in Kenya. And you can see that this is Serengeti National Park. This is Masai Mara National Park. If you look at only the map, you say that, okay, this is yellow fever area. And across the line, there's no yellow fever. Do you believe that? This is something tricky when you see the map, and be careful. So that's why I usually focus you that detailed itinerary is very important, because I would suggest them to get yellow fever vaccine, especially if they travel to Serengeti National Park. In fact, there's no mosquito nets along the border, right? It's just the political border that we create. I mean, human create themselves, but the mosquito can travel across the country, right? And at the border, they have just one stone. T means Tanzania. K is Kenya. That's it. So you can see that this side there's no mosquito, no yellow fever, and this side there's yellow fever. No, right? So try to detail on itinerary, just the example. All right, so this is the new emerging health problems among travelers, and you can see that it's been reported in many places. And then here in Indian subcontinent, can you guess what is the health problems? Yeah, they keep reporting after 2014 and increasing. And I would say it's increased a lot, especially now. Can you guess what's the problems? It's not infectious disease. Sorry. Okay, because of the time. So this is, we call this selfie-related death. You will see lots of travelers who die or get some fatalities after they do some content while they travel, and they keep reporting a lot. I would say, yeah, something like this, that they try to selfie with the train and they got hit by the train, or they fall from the tall towers after they get into the selfie, for example. This is for in Thailand, we have also uh, uh, ongoing reported of selfie-related death among travelers in the tourist attraction as well. So I think in Hong Kong, have you heard about selfie-related death? Yes, right. Especially in the nature's, landscape, for example. Yeah, if you compare, I would say the risk to die from selfie-related death is higher than malaria death. So in recent here, you see that within 12 years analysis, we found death almost 300, almost 400 cases death from selfie-related death. But for malaria, in 13 years, we have seen just only 12. Right? It's still the problems that we have to consider as well. So if you're interested in the knowledge of the travel medicines, actually they have the body of the knowledge set by the International Society of Travel Medicine that creates the thing that you should know if you're interested in travel medicine. It's cover epidemiology, immunology, pre-travel assessment, disease, contract while travels, and also with the post-travel assessment in the website as well. This is some of the results. And the thing is that at the moment, not only the infectious disease rates, but also with given the climate change, we have seen a lots of health problems related to the climate. For example, heat-related illnesses. You can imagine that in Bangkok in summer, when the heat waves hit, the temperatures may surpass 45 degrees Celsius in the afternoon. 45 degrees Celsius. You cannot survive without aircon, I would say, right? Sometimes it surpass in India, it surpass 50 degrees Celsius. And the ones, for example, you lives in the cold weathers or the ones who from the very cool weathers and you never acclimatize with this kind of temperatures, you may experience with these problems as well. And air pollutions when you travel during, I mean, especially in January, February, and March in Southeast Asia, we have a lot of air pollutions. And we found that the air pollutions can affect both short-term and long-term travelers to travel in the area. So challenge in the travel medicine is that the climate change, emerging infectious disease, changing patterns of the drug resistant. I mean, some of us will cover this topic tomorrow. And elderly travelers, we are going to the elderly society. So we have a lot of elderly travel and the vulnerable populations that can develop some severe or complications of the disease while they travel. AI technologies while travel, decision-making tools for clinicians, it's will coming up and it will be challenged in travel medicine as well. So just to let you know that the biggest conference in travel medicines or the conference of the International Society of Travel Medicines will be held in Bangkok in 2027. So hope to see you there. Thank you so much.